Hi, my name is Kathleen Martinez. I am an infection preventionist at Children's Hospital Colorado. Prior to my role, which I started on March 11th of 2020, I served as a nurse here, and so I have a great familiarity with the hospital. I'm very excited to have a chance to present our project today, incorporating infection prevention and antimicrobial stewardship handshake rounds. I'd like to introduce you to my friend Sarah Parker.
Hi, I'm Sarah Parker, and this is the home of Handshake Stewardship. We've been doing Handshake Stewardship since 2013, and we track lots of different kinds of data, and I will be Kathleen's mentor, and I'm very excited because she gets things done. So Handshake Stewardship is now considered a best practice by the Joint Commission, and Children's Hospital is a 450-bed hospital, and it's a great place to incorporate nursing and infection control into stewardship rounds.
This is so great because we've been talking about this for over a year now, trying to get infection preventionists to interact with providers, talk about isolation, address any questions about that. And also the evidence shows that nurses are reluctant to be involved in antimicrobial stewardship rounds. They feel they don't have the background in microbiology, nor do they feel confident in what they feel is a provider or physician's role. So the opportunity to create a welcoming space just sounded exciting.
Yes, and when we're on handshake rounds, we get asked infection control questions all the time. And we have had some trouble incorporating nursing just based on enthusiasm, but they are very curious about infection control. So we really feel like this is going to be a great hook to get the nurses involved in stewardship and then also help our providers out with infection control practices.
Definitely a win-win. And just to point out, the CDC worked on a white paper with the American Nurses Association and has identified 15 separate areas where nurses already are engaged in antimicrobial stewardship behaviors and activities, but that's just not called out specifically. So the hope is to create a warm, inviting environment, allow people to act naturally, be part of really conversational rounds where they can feel safe with their learning and to move forward in getting nurses more engaged.
Let's go on handshake stewardship round.
Hey friends.
Hello.
How are you?
I'm good. How are you guys? Good. So I had one question for you for stewardship rounds today. You have that patient with enterococcus in the urine. It's fecalis, so that in our hospital is always ampicillin susceptible.
Okay.
So you can switch if you want.
Beautiful.
And then I wanted to ask you a question. If we had somebody with infection control with us on rounds, would that be something you would look forward to?
Absolutely. That would be great.
We always need help.
That would be awesome. Yeah, I feel like we don't get this face-to-face time that we're getting now very often.
That would be awesome. I think that would give us a ton of benefits. So.
Yeah, could just kind of talk about like isolation precautions or getting kids off precautions, which is always a huge question. Just information like that. And then everybody's questions about isolation and infection control.
Yeah, that would be super helpful.
It's a lot easier than an email too, to have somebody to ask questions of. So.
Yeah, no, I feel like those aren't super like up to date. We send an email and then I would check it for a week and then we get back our answers late. So
It's like a daily question we have.
Yeah, I have a patient who has RSV. She was tested about a week ago. Can she come off of isolation yet?
Well, I can give you the short answer, and I can also show you how to find the policy. So
Okay,
the next time you
awesome.
have to find it. We want to make sure we cover what kind of data are we collecting and what are our methodologies. So what we talked about is starting with some focus groups similar to the conversations you've seen us have already, and then really working through what we learned from there with our survey specialists to create a survey to collect a little more information.
And we'll monitor this data on a regular basis so we can use it for plan, do, study, act cycles to improve things. And some of that data also will help us target the most common infection control questions and why those questions are the common ones and what else we can do to educate people around those really pressing issues for them.
So to wrap up, we'd like to thank Chris Nyquist for her support and endorsement of this project. And I'd like to introduce Christine McBrain, one of our ASP pharmacists.
Thank you. To talk about some of the data that we'll collect, this is a screenshot of an intervention that we use to collect data through antimicrobial stewardship. If you look here at this slide, we do collect interventions specific to infection prevention, and you can see here the percent at which we've done that this far.
We also have a nationally known survey specialist who will help us define a patient satisfaction survey for providers and for nurses. And we will look at missing and mismatch isolation orders. We'd like to thank you for your support, and we look forward to seeing you at CHCO.